in Trinidad and Tobago, and happy Monday morning. Thank you for tuning in to the Ministry of Health's COVID-19 media update, where we provide you with the most accurate and up-to-date information on the national COVID-19 response. Today on our panel of presenters, we have Dr. Miriam Richards, Principal Medical Officer, Institutions at the Ministry of Health, Dr. Avery Hines, Technical Director, Epidemiology Division, Ministry of Health, and Dr. Alana Kwamina-Best, County Medical Officer of Health for the St. Andrew and St. David regions. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health and your moderator for today's update. I will now hand you over to Dr. Richards, who will provide us with the latest clinical, vaccination updates, and a short presentation on the current status of the parallel healthcare system. Dr. Richards, good morning.
Thank you very much, Al. Good morning to my colleagues, Dr. Hines and Dr. Alana Best from the Eastern RHA. Good morning to all members of the media. Good morning to the viewing and listening population of this media conference broadcast locally, regionally, and internationally. Thank you once again for the opportunity to present you with an update on the clinical status of the hospitals in our parallel healthcare system, as well as a recap of Media Release 887 as of 4 p.m. on the 24th of October 2021. I'd like to now provide an update on the COVID-19 situation as of 4 p.m. yesterday. An additional 244 cases of COVID-19 were confirmed in the last 24 hours. This takes the total active number of positive cases to 4,656. These cases are distributed as follows: 4,467 patients in home self-isolation being monitored by the relevant county medical officers of health, 31 patients at step-down facilities in the parallel healthcare system, 314 patients in hospital in the parallel healthcare system. Unfortunately, there have been 6 additional deaths, and this takes the total number of deaths to 1,645, and we would like to extend our sincere condolences and sympathies to the families of the deceased. Regarding the vaccination update, the total number of persons vaccinated with a first dose of a 2-dose regime was 617,974, representing 44% of our population, while 551,791 persons have been vaccinated with a second dose of a 2-dose regime. The total number of persons vaccinated under a single-dose regime is currently 32,937, with 584,728 persons, representing 41% of our population, with a completed vaccination regime. It is important to note, and I'd like to summarize and to speak about this statistic in the second half of my presentation, that 4,178 of 4,437 persons in the parallel healthcare system between July 22nd to October 6, 2021, representing 94.1% of all persons in the parallel healthcare system, are not fully vaccinated. And this morning, I'd like to appeal to the population on behalf of all our physicians and our frontline team of all the persons who have been volunteering within the parallel healthcare system and on vaccination drives to please be vaccinated. I'd like to now focus on a worrying situation in the hospitals of our parallel healthcare system, as well as the accident and emergency departments in our traditional healthcare system. Ladies and gentlemen, over the past month, Dr. Trotman, myself, and most recently the Honorable Minister of Health have sounded caution about the number of patients, the number of our citizens and nationals who are being admitted into the intensive care unit in the hospitals in our parallel healthcare system. I have repeatedly ask the population to not be prematurely comforted by the overall hospital occupancy levels, which at this point have been consistently under 40% for the past 101 days. We have noted that the demand for intensive care unit beds continues to be increasing, or continues to demonstrate an increasing trend over the past month. The healthcare team, on behalf of the medical frontline staff, has respectfully appealed to our population to please become vaccinated. We have several sites across Trinidad and Tobago with vaccination available 7 days per week throughout our country. And again, I'd like to remind everyone that 94.2% or 4,178 persons of 4,437 admissions to the parallel healthcare system. And these admissions are our families, our friends, persons within that we know, persons within our population. We don't just see them as a number or a case. 94.1% of these persons in hospital are not fully vaccinated. This morning I come to you with grave concern, as I can confirm that the intensive care unit demand within our country has now outstripped or is equal to the supply of beds. On Saturday, the Honourable Minister indicated that this was a trend for concern because we were approximately 90% filled. Today, the 25th of October 2021, the Ministry of Health can report that almost all our beds in Trinidad are filled. Now, in preparedness for the arrival of the Delta variant, the Ministry of Health has been trying our best to upscale or increase the number of intensive care unit beds across the hospitals in our parallel healthcare system. And we did increase on a phased basis by reallocating resources and adding resources the number of intensive care unit beds by 25%. The Honourable Minister indicated this on Saturday. Over the weekend, we again increased capacity to manage the increased demand for beds. But this AM, the demand has exceeded the supply, and this is a factor that Dr. Trotman and myself repeatedly warned the population about. Just for context this morning, I'd like to provide you with actual numbers regarding the number of patients in our hospitals and in the intensive care unit, as well as their vaccination status. So at the Couva Medical and Multi-Training Facility, we have all 22 beds occupied, so 100% occupancy in the intensive care unit, with 21 of 22 patients unvaccinated. That's 95% of persons at the Couva Medical and Multi-Training Facility in the ICU that are unvaccinated or not fully vaccinated. At the Arima General Hospital, all 10 beds were occupied in the ICU department yesterday. An additional 2 beds were operationalized based on demand, so all 12 patients in the intensive care unit are not fully vaccinated. At the Augustus Long Hospital, there are currently 10 operationalized or fully staffed beds for intensive care unit patients. 9 out of 10 are occupied. 8 out of 9 of those persons are not fully vaccinated. At the Point Fortin Hospital, 4 out of 4 beds are currently occupied, 100% ICU occupancy, nil patients vaccinated, fully vaccinated. At the St. James Medical Complex, 4 out of 4 beds for COVID-19 patients in the ICU are occupied, 4 out of 4 not fully vaccinated. And I'd like to reiterate that fully vaccinated means 2 weeks after a 2-dose regime or 2 weeks after a single-dose regime. So this morning, 96% of patients in the intensive care units across Trinidad in our hospitals are not fully vaccinated. We also look at the situation in the accident and emergency departments of our traditional healthcare system. That is the RHA department, San Fernando General Hospital, the Arima District Health Facility, and so on. As of 8:30 a.m. this morning, there were 27 severely and critically ill COVID-19 patients awaiting transfer into the parallel healthcare system. Of those, 9 patients, representing 33%, were of ICU or intensive care unit level. So, in addition to us having reached almost maximum capacity, 9 persons, 9 souls, are awaiting intensive care unit care in the parallel healthcare system and are being ventilated and managed in the accident and emergency departments. Of those 9 persons, none of those souls is fully vaccinated. Ladies and gentlemen, this trend is a serious cause for concern. We have been monitoring these trends over the past month, and we've been appealing to the population to please become vaccinated. Please obtain your vaccine. Encourage persons around you to be vaccinated. We have been trying our best at the Ministry of Health to increase the capacity for ICU beds based on the demand, based on the preparedness for the Delta variant. But a bed is not just a bed. And these beds require staff, equipment, and many other factors. You know, we have to consider the ambulance transfer system as well to transport these critically ill patients that require ambulances that are known as advanced life support units. Ladies and gentlemen, we have tried our best and we continue to try our best. And we appreciate your compliance with the 3 Ws. We appreciate your compliance with the public health regulations. However, I would like to leave you this morning with the promises, the 3 promises of vaccination. Vaccination reduces the risk of you acquiring the COVID-19 virus. Vaccination reduces the risk of you spreading the COVID-19 virus, especially to vulnerable persons. And vaccination reduces the risk of you being hospitalized and requiring intensive care unit treatment. Ladies and gentlemen, please, on behalf of the Ministry of Health team, the RHA team, and the frontline staff, let us please exercise our civic, social, and personal responsibility. Let us please remember these statistics that are really a cause for concern, and please let's encourage and empower those persons around us who are not vaccinated to be vaccinated. Thank you very much, Al. I'll pass over to you.
Thank you very much, Dr. Richards. At this time, we will now go to Dr. Hines, who will present the epidemiological update. Dr. Hines.
Okay, thank you, Mr. Alexander. Good morning to my colleagues, Dr. Richards and Dr. Best. Good morning to members of the media, members of the viewing and listening public. If we can go straight into my first slide, we'll go directly into the current epi curve or the epidemiologic situation. Next slide, please. And if we look at this slide, we're looking at the colors representing different months. The bright green at the end is currently the month of October. And while we do see that those daily numbers are just about the same or similar in height to the numbers or to the heights of the bars prior to those, what we do notice is that there isn't as much of a down sweep, whereas we did see fluctuations higher and lower, giving you an average of the 200 or so cases per day. For October, it's been a fairly consistent 200, sometimes a little over from day to day. And that by itself, if we go to the next slide, we're seeing that we're actually beginning to see week-on-week increases as opposed to the fluctuation that we were seeing before. So whereas in week 41, we noticed that there was just a 0.7% increase over week 40. Week 42 continued the increasing trend with another 10% increase. So whereas we were fluctuating, going down 1 week and up the next week, we've so far seen 2 consecutive weeks of upward trend. In fact, 3 consecutive weeks, because it was 10.5% the week before, 0.7, and now 10.2. So this may indicate a change in the direction of the epidemic, and we're carefully keeping an eye on that as we look at the performance during the course of this coming week. Looking at that background section, the salmon color, we see that that has generally hovered between 25 and 30%. But for the samples that would have been collected and processed yesterday, out of that batch yesterday, the percentage positivity was a little higher. We'll see what happens during the course of the remaining days of this week before we make a pronouncement on whether positivity has actually begun to increase as well. If we go to the next slide, we see that for the month of October, it still has basically 7 full days remaining. If we continue at that 200 or so new cases per day, we will actually exceed the totals for July, August, and September. Again, indicative of that potential increasing trend. So we're sounding the warning at this point that there is indication that there may be a potential increase that we are observing, and this may very well be as a result of the knowledge that we have that there is the new and more transmissible Delta variant circulating in the population. So again, it's a cause for concern, it's a cause for extra caution, it's a cause for adherence to both the public health regulations, stipulations, guidelines, and it's a cause for us to get vaccinated so that we reduce the risk of serious illness, even in the presence of infection. Let's go to the next slide. The demographics have not changed significantly throughout the course of the pandemic. We've seen that the majority of individuals getting ill have been in that 25 to 49-year age range, and that the male-female balance has been just about 50-50 throughout. Next slide. Among the fatalities, we have noted that about 2/3 of them were in the over 60 age group, and we also noted, not visible on this slide, that the individuals who did have adverse outcomes were those who had additional pre-existing complications or conditions which we call comorbidities, including things like diabetes, hypertension, asthma, chronic kidney disease, treatment for cancer, things that impair your body's ability to respond to this new virus. And both globally and nationally, it has been noted that vaccination helps to reduce the risk of individuals, including individuals with comorbidities, reduce their risk of having serious illness and of having a fatal outcome. So we want to again remind persons who may still be deciding, who may be undecided, especially those with comorbidities, yes, vaccination is for you. Check with your physician if you are concerned, but make sure once you've done so, once you've checked with your physician and there is no reason not to be vaccinated, that you go ahead and avail yourself of the available vaccines. Next slide, please. Looking at the next slide, we see the geographic distribution, which has been fairly consistent. We see the largest or darkest numbers representing the largest, darkest areas representing the largest numbers rather, in the most populated of the communities. We see that right now that darkest area being the Sangre Grande area, and we actually have the Sangre Grande CMOH that we can relate some of that in terms of both activity and in terms of what you'll be speaking about, which is the ability to go check yourself and take care of your health in general. So it's good timing on that account. If we go to the next slide, we see that again we're seeing some of the week-to-week changes between starting to be increases in a few of the counties and decreases in a smaller proportion of the counties. So that again may begin to explain that we are seeing something resembling an upward trend, maybe not in every county, but in more of the counties than not, again representing the fact that we may be having some additional transmission, an additional or an increasing rate of transmission that we do need to keep an eye on. And it's again a reason for us to take extra care of ourselves and of those around us by following the public health guidelines and by getting ourselves vaccinated. If my last slide, we can look at those changes across a longer time scale by county. And we are seeing that if you look at the last 3 bars or so in each of the counties, some of them have had downward trends, some have had upward trends, and some have had basically fluctuations around the same number. But we're seeing that they're increasing numbers of counties that are demonstrating an upward trend over the last few weeks, over the last 3 weeks or so. So again, we're sounding the alarm that there may be increasing rates of transmission we have to keep an eye on, We need to continue to adhere to those public health regulations, even as we move around more, engage more in various activities. And definitely we need to ensure both the protection of ourselves and those around us by making use of the available vaccinations. With that, I turn you back over to Mr. Alexander.
Thank you very much, Dr. Hines. And as you are aware, the Ministry of Health, in conjunction with other ministries, regional health authorities, and NGOs, will host a national care fair. And that will be on the 28th and 29th of October, Friday and Saturday. We are pleased to have Dr. Best with us this morning, and she's here to tell you more about the National Care Fair and more specifically, what plans are in place for the persons in the Eastern Regional Health Authority. Dr. Best, good morning.
Thank you very much, Mr. Alexander. Good morning to Dr. Richards and to Dr. Hines, members of the media and members of the viewing and listening public. Thank you for inviting me to talk briefly with you today about our upcoming initiative as part of the National Care Fair, which is taking place on the 29th and 30th of October. Good primary health care is essential, and it is the first level of contact of individuals, families, and the community with the national health care system. Good primary health care seeks to bring health care as close as possible to where people live and work. The challenge of the COVID-19 pandemic has in fact provided an opportunity for the healthcare sector to evolve the way in which healthcare services are delivered. Where possible, we have introduced telemedicine initiatives. We have reorganized our pharmacy services to facilitate consistent delivery of medication to our chronic disease clients, and we've even had door-to-door initiatives. Let us consider the overall aim of primary health care, which is to provide comprehensive care along the continuum of health promotion, disease prevention and treatment, rehabilitation, and palliative care. Understandably, our healthcare services have had a strong leaning towards the illness model for the last 18 months or so. However, we want to revitalize the wellness agenda by focusing on health promotion and disease prevention. All regional health authorities will be facilitating a national care fair on Friday, October 29th and Saturday, October 30th at varying locations across the country from 9 a.m. to 3 p.m. Within the Eastern Regional Health Authority, our fair will be held at the Sandy Grande Civic Center on both days. For persons without direct transportation, we will be offering regular shuttles between Birdie Square, which is next to Miguel Moses. So between Birdie Square and the Sandy Grande Civic Center, you can look out for our shuttle service to take you to and from the site. Our health promotion activities will include food and nutrition displays, physical activity demonstrations and challenges. Promoting good health is not solely the remit of the health sector, and so we are very pleased that our colleagues from the Ministry of Agriculture will also be on site to share tips on improving food production in our homes and how to use grow boxes. With regards to disease prevention, we know that non-communicable diseases account for more than 60% of all deaths in Trinidad and Tobago. These conditions would include things like high blood pressure, heart disease, strokes, diabetes or sugar, and chronic kidney disease, as well as cancer. In some instances, there are early warning signs and symptoms, and we want to encourage persons to be vigilant about their health. Specifically, we want to encourage individuals to know their numbers, which include their blood pressure, blood sugar, and body mass index. These three numbers give us good insight into a person's risk of developing high blood pressure, heart disease, diabetes, and strokes in the future. Early detection is important to improving a person's outcome. And in keeping with the importance of early detection to improving outcomes, We will also be offering HIV testing, pap smears to check for cancer of the cervix, breast examinations, and prostate checks. We will also be offering vision screening and dental counseling. And finally, vaccination against influenza and COVID-19 will also be available. So you may be asking yourself, why should I attend any of these national care fair sites? Well, whatever your age, it is important to learn about healthy living, and we are here to support you in achieving that. If you are over the age of 40 and are male, come along and get your prostate checked. We want to encourage women to have their breast and cervix checked. If there's a problem, early detection increases your chances of survival. If you are sexually active, it is important to know your HIV status, as being HIV positive is no longer a death sentence. And the safest way to protect yourself against an infectious disease is in fact through vaccination, and we will have vaccines available for both influenza and COVID-19. The National Care Fair will be offering persons a comprehensive package of screening tests. In the Sandy Grande area, we are looking forward to welcoming you this Friday 29th and Saturday 30th October at the Sandy Grande Civic Center, which is located on Sukram Street, Foster Road, Sandy Grande. Do feel free to check out the Eastern Regional Health Authority on our Facebook page for more information. Thank you.
And thank you very much, Dr. Best. I think I'll be making my way down to the ERHA on Friday or Saturday to take part in this care fair. October marks the beginning of the 2022 flu season. To speak more about that issue, we go back to Dr. Hines.
Okay, thank you, Mr. Alexander. Just picking up on some of the information that Dr. Best would have shared, as we are aware, as we move into what they consider the fall or autumn and winter months of the Northern Hemisphere, the increase in influenza transmission, especially in the Northern Hemisphere countries, is a regular yearly occurrence. It is called the flu season, and that hasn't disappeared or changed in the face of the COVID-19 pandemic. As such, and because we know that we have now increased movement of individuals between this country and countries further north, the US, the UK, etc., we are reminding the population of the importance of having their regular yearly influenza vaccinations, because influenza is another transmissible, meaning you can spread it from one person to the next, respiratory illness or infection that can take lives. And we have noted that since the uptake or the increased uptake of influenza vaccinations over the past couple of years, our influenza figures locally, including our influenza deaths, have decreased. We hadn't had any recorded confirmed cases of influenza deaths over the last 2 years. That's both 2021 and 2020. And we want to encourage those individuals, especially those in the high-risk groups, and those high-risk groups are individuals over 60, individuals with any pre-existing comorbid condition, most especially diabetes, obesity, asthma, and the like, individuals who are pregnant, and children between 6 months and 5 years of age, to ensure that you get your influenza vaccination, as those are widely available. They are available at all of the health centers, and this reduces the risk of picking up another transmissible infectious disease, reduces your risk of having that confused with whether you have COVID-19 or not. So we do want to keep the population as safe as possible from as much as possible, and therefore we want to take this opportunity to encourage all of the population, and especially those in the high-risk groups, to make use of, avail themselves of, and go and get their influenza vaccinations. Thank you, Mr. Alexander.
Thanks again, Dr. Hines. Next up is the question and answer segment. We once again remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Please ask these questions one right after the other to the relevant member of the panel. If time permits, we will accommodate a second round of questions This time, one question per media house. Today we begin our question and answer with Guardian Media Limited.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Dr. Richards, my first question is for you. How feasible is it for us to continue treating ICU patients at the accident and emergency wards? And has any consideration been given to probably outsourcing some of these treatments from private hospitals? And my second question, Dr. Hines, I know you said you were sounding the alarm that there appears to be an increase in numbers, but how easy or where are we at possibly establishing another wave of infections? And how easy could that we slip into that? Thank you.
Good morning, Richard. Thank you very much for that question. The first part of your question dealt with the capacity to manage intensive care unit patients at the accident and emergency departments in the traditional healthcare system and, of course, in the parallel healthcare system. I'd like to reiterate a couple of facts. Firstly, the Ministry of Health has been actively increasing and upscaling the number of intensive care unit beds in the parallel healthcare system as part of our Delta preparedness plan, which we started approximately 2 months ago, because we anticipated an increased demand for intensive care unit and high dependency unit beds. At present, we have upscaled our ICU capacity in the parallel healthcare system by 30%. Of course, I would have indicated that the vast majority of those beds are filled as of this morning in Trinidad. Secondly, the management of a COVID-19 patient is carried out by the clinical team consisting of specialists in intensive care unit medicine, critical care, and internal medicine, and others. At the traditional healthcare system, or in the traditional healthcare system, these consultants work as a team in the accident and emergency department to ensure that ill, severely and critically ill COVID-19 patients receive the best level of care prior to transfer. Now, as I said this morning, 9 out of 27 persons who are awaiting acceptance and transfer into the parallel healthcare system require ICU level care. I'd like to reiterate, ICU, not HDU. We have noticed that persons are presenting in a very critically and severely ill state when they enter the accident and emergency department. And secondly, we have also noticed that the ratio within the parallel healthcare system of severely and critically ill patients is now at 10-1. This was 3-1 approximately 8 weeks ago and has consistently increased. We are satisfied that at the accident and emergency departments, the resources once available are sufficient to manage a COVID-19 patient prior to transfer. However, many of these patients are very unstable and so cannot be transferred immediately. They need to be stabilized. Regarding the management of COVID-19 patients in private hospitals, the Chief Medical Officer would have indicated that COVID-19 patients can be managed at the private hospitals, and there have been some patients who were managed in the private institutions. However, at this point in time, the Ministry of Health does not have a policy decision or has not taken a policy decision about outsourcing services. I'd like to stress that in order to manage a COVID-19 patient, even in the private institutions, the Ministry of Health really would guide the institution with respect to infection prevention and control practices. So there is some collaboration in that event. So thank you very much, Rashad, and I hope I have given you a comprehensive report on this question.
Thank you very much. Go across to Dr. Hines.
Okay. Not sure this is working. Is this mic working?
Yes, it is.
Right, it is now. Thank you. Yes, thank you for the question, Mr. Khan. Now, it's a very good question. Again, we are seeing a point where we are beginning to notice very small changes in trend, and those small changes, if we aren't applying all the other braking factors, can, of course, multiply in rate as time goes on, spawning another wave. What we are very much hoping is that the behavior of the population in terms of vaccine uptake in terms of adherence to all of the regulations, in terms of not breaching the guidelines around participation in group activities. All of those factors will help to slow the possibility of an increased rate of transmission. So we do have additional movement. We have much higher levels of movement now than a few months ago, but we also have a more vaccinated population, which we hope will help to slow transmission. And we have additional movement among vaccinated groups as opposed to not, and that will hopefully also reduce the risk of rapid increases. Nonetheless, we are monitoring the trend and we will continue to advise as we see any additional increases or changes in rate, which should be of concern. So hopefully that gives you some picture of what could lie ahead and how we can prevent another big wave.
Thank you, Dr. Hines. We now go to the Express. Express, good morning. You may pose your question. Good morning. Okay, seems like we're having some technical difficulties, so we'll move on to the other. CL Communications, good morning.
Good morning, Natalie Singh, Caribbean Lifestyle Communications. I was just wondering, has TNT reached a point where it needs assistance with its COVID-19 response? Hearing the call from Dr. Hines that, it's trends are showing that there could be an increase. So that's why I'm asking that. And then secondly now, what is the vaccine uptake in the St. Andrews, St. David County? Thank you.
Okay, thank you very much.
Okay, thank you. If indeed we need assistance, the assistance that we would need is the assistance of the population. Because at this point, it's really only the members of the population that can increase our vaccine uptake. It's only the members of the population who aren't yet vaccinated who can contribute to reduction in risk of another wave by getting themselves vaccinated and slowing the possibility of transmission. So that would be the assistance that we'd be calling for at this point in time. And I hope that we recognize exactly how important that particular call for help is. We are calling for the help of the population in adhering to the guidelines and in getting vaccinated. That's basically the kind of assistance that we would need at this point to slow the transmission and to reduce the risk of another large wave being sparked off by the trends that we're currently seeing. So hopefully that puts it into context.
Thank you, Dr. Hines. Dr. Best, I invite you to respond to the second question.
Thank you. Thank you very much for that question. So within County St. Andrews, St. David, we have 11 health centers. Since vaccines have become available more widely, we have vaccinations available every day, Monday through Friday at these health centers. We have had multiple outreach campaigns at some of the more popular supermarkets towards month end. We have gone door to door, but there is a shortfall in our vaccination rates. So I can tell you at our last examination, we know that there are some areas, for example, the Manzanilla area, where we have less than 10% of that population coming forward to be vaccinated. And not surprisingly, there are a number of cases in the Sangli, Chiquito, Manzanilla, Fishing Pond, Plumita area. In particular, Plumita is taking off in the last couple of weeks with an increase in the number of cases in that relatively small community. We know that in areas such as San Souci, less than 5% of that population has come forward to be vaccinated. Similarly, in Valencia, we have just over 10% of that population that has come forward to be vaccinated. And so we continue to do the work. It is a labor of love because persons are not stepping forward, and we do really want to continue to plead and encourage. Vaccination affords you an additional level of protection. Dr. Richards gave us some very grave numbers today, and certainly we don't want anyone to end up needing ICU care and it not being available to them when it's entirely preventable. So I'd like to take the opportunity to encourage persons within St. Andrews, St. David and elsewhere, please protect yourself. make use of the vaccines. They are effective in keeping you out of hospital. And if I may just add, we have about 8 known Delta cases within our county. One of them, I think, is a prime example that beautifully illustrates the power of vaccination. We've had the primary case who was vaccinated with Johnson & Johnson. His symptoms were mild. He only had nasal congestion. His wife was fully vaccinated with Sinopharm. She never became positive. Their son received 1 dose of Pfizer, and he turned out to be positive, but he was asymptomatic. All 3 of them have fully recovered and have returned to normal life. And so I just want to encourage persons, please, the vaccines work. Get vaccinated.
Thank you very much, Dr. Best, for that response. We go back to the Express for your questions.
Good morning, everyone.
Okay,
Leo
great.
Sorayas from the Trinidad Express newspapers. My questions are for Dr. Abdul Richards. Doctor, can you tell us how many of the 102 confirmed Delta cases are currently active? Also, are you able to give a breakdown as to how many of the active Delta cases are children, how many are currently hospitalized or in ICU, etc.? Thank you.
Okay, thank you. Dr. Hines, could you treat with that question?
I
you.
think I'll steal that question from Dr. Richards. With respect to the Delta cases, as you are aware, one of the things that we do is that we maintain the active status until such time as we get a negative testing out of the of that positive state. And we have had in that time frame several people who have actually moved beyond, but I don't have the exact number right now, but several of those cases have now moved beyond the point where they continue to test negative. So that of the 102, while I will have to endeavor to get the updated number that have been discharged, so to speak, from positive status, it is not all of them that continue to be active, i.e. that means that the Delta status isn't a permanent status. So we do continue to monitor that. We will get that proportion to you at a later point in time. There have been a small number of children usually associated with positive adults. Again, the issue is that, and we want to ensure that people understand that the 102 cases that we have identified don't represent all the Delta cases in the population. It's quite important to note, and we have made the point on several occasions in the updates, that these cases would have been in contact with other positives who weren't sequenced, but who would then be assumed also to be Delta. So that the proportions and the numbers that you're seeking here don't, again, represent the entire local situation. It represents a proportion, that proportion that has been captured and sequenced. And we need to focus more on the extra measures that we should be taking to prevent infection ourselves. And those measures, as we always reiterate, are the measures of getting yourself vaccinated and avoiding the congregations, avoiding people who are ill, washing your hands, wearing your mask, watching your distance. That's really what's going to help us at this point in time. So we want to emphasize the importance of those against the backdrop of more than 102 cases. We know that there will be more than that in the population. Let's not focus so much on that number and focus more on the state of known community transmission and the additional need for care in our day-to-day activities.
Thank you, Dr. Hines. Paul 102 Digital, we are ready for your questions.
Good morning, Sparkle McIntosh, Power 102 Digital. My first question is for Dr. Abdul Richards. Doctor, the CMO stated previously that the survival rate of persons going into the ICU is good, but can you give specifics as it relates to the percentage of persons surviving on a month-by-month basis over the last 3 months? And my second question goes to Dr. Hines. Is there a particular region in which the Delta variant seems to be prevalent? Thank you.
Good morning. Thank you very much, Ms. McIntosh. The information regarding the actual mortality levels or the number of persons who have passed away in the ICU is not available at hand right now, but you can make the necessary inquiry through the corporate communication department. It is a calculation that we need to be extremely accurate in terms of how we go about doing it, and there are several factors that we do take into place. So I'll kindly ask you if you could request it via Corpcom for an answer. Thank you.
Thank you.
Okay, again, thank you for that question. But the question sort of emphasizes a focus in what I want to consider to be a direction that is less relevant at this point in time than the overall national awareness of the need for care. There have been Delta cases that have been detected in all 9 counties. All 9 counties, meaning the 8 counties in Trinidad and Tobago as a county unto itself. So it is not a situation where we can identify one area as Delta is more prevalent here or there for the reasons that we have previously mentioned. And those are that there will be undetected cases, meaning cases that have not been identified and sequenced, among and related to and sometimes unrelated to the ones that we have identified. So making a statement about where there may be greater prevalence just based on the numbers we have would likely be inaccurate and misleading in terms of people thinking, well, here is safer than that particular place. At this point, nationally, we need to all be on the same page of increased care in our daily activities, increased adherence to those public health recommendations, and increased uptake of the vaccination.
Thank you, Dr. Hines. AZP News, we are ready for your questions. Good morning.
Good morning. Priya Bihari, azpnews.com. My first question is for Dr. Abdul Richards. Dr. Richards, you have always said that a bed is not just a bed, meaning that there are more resources that you put when you have a bed. What happens now when we have the ICU? You have no more room and no more space in ICU. What is the policy? What happens to a patient who needs ICU care and cannot get it? Thank you. And my second question is for Dr. Hines. Dr. Hines, as you know, today is the start where Form 4s to 6 return to classrooms. Some parents say they are scared. They are threatening to sue, saying that if their vaccinated child contracts COVID, that would be very unfair to them. And I want to find out if having both vaccinated and unvaccinated children and teachers in school, is that contrary to the policy of the Ministry of Health, where for example, in safe zones, you only allowing vaccinated people. So I just wanted to get your take on that question, on that issue. Thank you very much.
Thank you.
Thank you, Priya. So thank you for highlighting that statement that was made very early on in the management of the third wave, that a bed is not just a bed. And when we speak of an intensive care unit bed, we do not just speak about the physical bed and the spacing or the available physical space in our hospital. We are also referring to the level of nursing care and physician care, the specialists that are required to maintain and to provide the best level of care for that patient. And we use national guidelines that were adapted from the World Health Organization guidelines. And these are devised and formulated, adopted and adapted, as we would say, by our clinical management team, which is a national team led by Dr. Trotman. The other components of an ICU bed are as follows: ventilators, consumables like the oxygen lines and masks that go with the ventilators, the appropriate oxygen concentrators, and also we have to consider the availability of dialysis machines, as well as the availability of lab testing. And in some cases, some cases we have special or specified dialysis machines that must be used. We, of course, recognize, and this is not just in Trinidad and Tobago, but this is a global situation, that resources will eventually be expended. And at this point in time, our rate limiting or critical factor would involve human resources, because of course we are reallocating doctors and nurses to ensure the best level of care within the parallel and traditional healthcare system. So with that in mind, if resources are being expended, the Honourable Minister and the CMO and others, Dr. Trotman, would have indicated that a triage system will have to come into play. And that's a system where we have to look at the clinical parameters of the patient. We have to look at their prognosis and determine now which patients will be admitted into the intensive care unit. And I mean, this is an approach that is really occurring globally. It's a cause for concern, and of course we appeal to the population respectfully, please obtain your COVID-19 vaccine. Thank you.
Thank you, and let's hope that we don't really have to reach to that stage.
Okay, thank you, Mr. Bihari. Moving on to your second question, I thank you for raising that query that I think still remains in the minds of individuals, and is something that needs clarification, where it's not really a fair or relevant comparison to compare a school with a safe zone. The safe zones are spaces that have been established basically for recreational activity among fully vaccinated individuals. This is activity that, whereas it is economically viable and valuable, it isn't considered absolutely essential, and therefore you can make stipulations around individuals being fully vaccinated to participate in these activities so that you have additional movement with reduced risk. Whereas the school setting is not that recreational or non-essential setting and can't be compared with a safe zone in the same manner. So we're hoping that people do understand the difference between what applies to the safe zone concept and what would apply to essential activities, to activities that go beyond recreational to having additional necessity. So the bottom line, the underlying factors remain the same, and those are vaccination will reduce risk both of contracting illness and of getting more severely ill if illness is contracted. And it is a good idea for those who have not yet been vaccinated but have the opportunity to do so to go ahead and get their vaccines, because this helps both you as an individual and those with whom you interact. This is a plug that we'd like to make yet again in terms of the vaccine uptake at all levels, including the school age group.
Thank you, Dr. Hines. TV6, we are ready for your questions. Good morning.
Hi, good morning to the panel. Alicia Boucher from TV6 here. My first question, Dr. Richards, I wanted you to expand a little bit more in terms of the triaging of a COVID-19 patient, in terms of who gets the bed. Should it come down to that? Is it that you choose the patient that is most ill? Is it that you choose the patient that is most likely to survive? Does vaccination status have anything at all to do with that? Just delve a little bit into that for me. And I would have remembered the last lockdown that we had was because the parallel healthcare system was nearing capacity, and that was the entire parallel healthcare system. But I wanted to find out if you have a situation where your ICU and your HDU units are fully utilized, and those units are overwhelmed, can that actually trigger a countrywide lockdown?
Thank you very much, Ms. Boucher. I'll jump in here. Yes. Two excellent questions, and I know our time is limited at this point in time. We have not yet implemented a triage policy. We have respectfully cautioned the population of the potential need to implement this policy. However, if such a policy needs to be implemented, it will be led by the clinical management teams at each regional health authority, the relevant specialists, and Dr. Michelle Trotman, who is the clinical lead and a pulmonologist by specialty on our health team, national COVID-19 health team, will lead the efforts regarding the development of a triage policy. Your second question regarded the capacity of the parallel healthcare system and its impact on national measures such as the previous lockdown. The implementation or continuation of a lockdown, the restriction and relaxation of measures, is a policy decision that is taken by the Honorable Prime Minister and members of his cabinet. Thank you very much.
Thank you very much. And we now go to 103 FM. We're ready for your question.
Good morning, Rai Rikomas from 103.1 FM. Very quickly, Are there any added measures to monitor students as all of these students in forms 4 to 6 are going back out to school? And finally, what is the capacity of the ministry to further extend capacity in the parallel healthcare system, particularly in the ICU? Thank you.
Thank you very
Okay,
much.
thank you. I'll take the first bit of the question. The monitoring of the students directly is the remit of the medical team that works with the Ministry of Education. And we, of course, will provide any additional support that is required, including support with respect to analysis of data. I'll turn you over to Dr. Richards for the second bit of your question.
Thank you, Mr. Rikomas. The Ministry of Health continues to do all in our part to increase the capacity of ICU beds. However, resources are finite. We still do have a contingency for a few more beds. Of course, this is based on human resources and equipment. I can assure you that this is not a significant number of beds. With this wave, we have noticed that there has been a shift in demand for ICU level care beds as opposed to ward level beds, which we would have noticed initially in the April to June period. We do have a low occupancy in ward level beds, and we will be making or trying our best to gradually, on a phased basis, upscale the ICU beds. I'd like to reiterate that although we are trying our very best, resources are limited, and we are appealing to the population to help us decrease the demand for ICU beds through adherence and compliance to the 3 Ws, as well as vaccination. Thank you.
Thank you very much, Dr. Richards. Finally, we go to the Newsday. Good morning. Good morning, Newsday.
Hi. Good morning, Mr. Alexander. Nice to see you again.
Yes.
I hope you're good. My question would be, what has been the Ministry of Health's advice to the Ministry of Education on this first day back of when the unvaccinated pupils will be joining their vaccinated colleagues? The question would be, I'm hearing reports, for example, of shifts operating a shift system, but
Okay, we're having some technical difficulties in terms of the question. Are we able to salvage a response in terms of...
Possibly. So while we didn't hear the entire question, it is really a matter of the advice not having changed with regard to the mechanisms that we would want to have in place to reduce risk of spread in any place where individuals gather. And the operationalization of that advice would really be a matter for the staff of the Ministry of Education to go into in further detail. I'm hoping that answers the bits of the question that we weren't able to hear.
Okay. Would you want to try for the second question, please? Go ahead.
Yeah. Well, there was a concern about, as I say, I'm taking a different tack to my other colleague who asked questions a few minutes ago. But I'm saying that there is a concern, there could be a concern of discrimination rising or feelings of discrimination rising when people are discussing a separation of vaccinated from unvaccinated. Is there any policy decision based on the HIV crisis that had come on the scene about 40 years ago, based on lessons learned from that, of non-discrimination, that you really want to get everybody on board? Is there any message that one would want to send now in the case of the unvaccinated and vaccinated pupils? Thank you.
Okay, so again, just reiterating that however the protective measures are implemented and operationalized would be a matter for discussion with the Ministry of Education, but also to point out that HIV is a body fluid transmitted illness, and it is a completely separate consideration in terms of transmission and prevention of transmission from something that is airborne in nature. So I'm not sure that the conversation really applies in the same way. There would have to be a different approach to looking at what is appropriate and necessary, and I'm just hoping that that point is quite clear. So different modes of transmission would therefore make different kinds of preventive measures relevant. And HIV doesn't really apply to this particular situation. So I'm hoping that that issue is settled.
Thank you very much. Ladies and gentlemen, we have come to the end of today's media conference. We ask that you please continue to protect yourself and your loved ones. If you haven't received your COVID-19 vaccine as yet, please get yours now. We also encourage you to get your flu vaccine as well. Remember, the vaccines are safe, they are effective, they are free and available right now. So let's vaccinate TNT. As well, the National Care Fair flyer. The National Care Fair, finally, we invite the public to come out to the National Care Fair 2021 on Friday 29th and Saturday 30th October 2021. And that's this Friday and Saturday. You can get free screenings, health consultations, and vaccinations will also be available. So that's all for now. Thank you for viewing. Goodbye.
Vaccination is very important for the reopening of commerce and interaction in Tobago from a tourism perspective for a number of reasons. The first one, it's the best and probably the only known real defense, according to the medical professions, to shield us against the negative impact of contracting the disease, which is hospitalization and unfortunately demise. So we need to ensure that we have a healthy population, and this is the defense. So if we don't have